Okay. Well, good morning, everybody. Welcome to the November 12th HOPWA Workforce Coordination Team meeting. Hope everybody's doing well and enjoying the weather. Actually, Sylvester, how is it down there?
I'm actually in Memphis, Tennessee, and it's
Oh,
freeze.
well, look at that. Look at that. Let's see. Angelique's joining. Okay. Okay. So the psychosocial group update,
hmm
Pastor. Hey, can you hear us okay? Okay. Um, I don't think Pastor Andre is here today, but no worries. I talked to him after he went to the connections group about a week and a half ago. There is a list of interested parties, so I have that list. I just need to type it out and send it to the group. But off the top of my head, there were about seven folks interested. So that's good. We can, add that and we'll get them in contact with Tamara for the referrals and all of that good stuff. Um, as far as additional psychosocial groups that we are waiting to get on their schedule, we're still waiting to hear back for some folks, but we're not going to wait around. So I'm just going to call and get on schedules and see which meetings people are at so I can just ask them. I know this is the end of the year and people are taking time and things of that sort. Or even if there's an updated contact person, maybe that's the person that we need to be speaking to. Sometimes that happens. So we'll get to the bottom of that. What else? Oh, this isn't on here, but we were supposed to have a guest, John, the executive director of the Gay and Lesbian Chamber. I have not heard back from him for this meeting. However, once he gets back with me, hopefully we can have him at the next meeting in time for the holidays, just to see, how we can work together, if we can go present at the next group, or if he can come to us, or, whatever it is that we need for that. See here. Okay, so that's really what we had for the updates for the groups. We'll wait to hear back from Danielle to see when we're going to attend her group. But she also mentioned we may just have her be the point of contact for that group, which is equally fine. Just want to get the dates down just so we can put it in the calendar and have some concrete dates as to us doing this. But in regards to the reason we went to the group about the flyer, Pastor Andre said they have no edits, no updates. They said it was fine. They said that looking at the flyer, you're able to see exactly what it is, which was really nice to hear. Obviously, we want to have a round table full of folks, not can just go off one group, but it was a pleasant surprise to say, oh, it's fine. And especially being the connections group, I know they will not mince words with those things, so we appreciate them for that. But yeah, I wasn't able to attend it with him. I literally walked in there right as he finished, but I'm hearing good things. Um, Folks didn't even know that we were connected because he kept saying my name, and they were like, "Who?" And then I went down there, and they were just like, "Oh, him." I'm like, "Yes, it's the same name," but you know how it works. Different buildings, different worlds, right? So yeah, all good things to report. Um, We'll dive into the next piece, which is actually Tamara. I'm going to give us some workforce referral updates, and then I will jump on the tail end of hers to add some additional updates. Go ahead. Do you need the screen or anything?
No, I don't. Hi, everyone. So far we have 11 referrals. We met with the CMTI. We met with the prevention team at the CMTI to let them know about the referral. Um, and the
Can you
forms were
can you
sent.
tell us those acronyms? I'm sorry.
Oh,
Case
sorry.
Management Training Institute. It took
Thank you.
me, listen, it took me a long time to
It's
do
just
that too. So you're
CMTI. I
good.
forgot what
Yeah,
the,
yeah,
yeah.
yeah.
Okay.
So just to pivot, just to add some structure to it. So Mark and everybody else who hasn't attended one, the CMTIs, those are the biggest crowds for what we have. And we partnered with Angelique and made it happen. We had over 50 people this time. So it was all of, well, not all of prevention, but prevention was there. All parts of Ryan White, um, H.O.P.W.A folks were there too. So it was packed. And a lot of people's first time really interacting with us was during that time. So, and that was early in the morning. So I'm looking at some things to see what we can do for training going forward. But just to add context to what Tamara is saying, it was about 50 people.
Mhm. So we told them about the employment workforce, and I actually have one person that gave me a referral from the training. The forms were sent out with instructions, and Brendan and I have decided that every training we'll just have the referral forms out there for people to have. Um, my Oh, and one person got a job.
Oh,
What?
Yeah,
look at
yeah.
that. You should have led with
Thank you.
that.
Thank you. Yeah, thank you.
Oh,
Thank
Well,
that's
you.
you
really
buried
cool.
the lead.
Yeah. You're like, oh, I cured cancer. Like, what?
I didn't want to.
That's really
Yeah.
cool. Yes,
Thank you. Thank
yes.
you. Thank you.
Congratulations to
Yeah.
everybody. That's really cool.
Yeah.
Um, okay, to piggyback off of that, I attended the Mercy House. Oh, go ahead, Abby.
Quick question. Sorry, I can't figure out how to
Oh,
raise
you're
my hand
good.
fast enough here. So for the referrals that you do have, so what is the next step? Like, do you
So
reach
I
out
call
to
them.
them?
Yep. So I reach out to them. I ask follow-up questions. I partner with Jill. She assists me. Um, I do. I take them to the American Job Center and we fill out the CT hire work, the CT hire profile. Then we get we start looking for jobs.
And then
Yeah.
do you give updates to the person who made the referral, or
Yeah.
is that per request?
Yeah.
Okay, so
Normally I'm working like
updates for my
one-on-one.
person.
Okay, for sure. For sure.
Yeah, because I just want to see how it kind of works so we can
Yeah.
get more
Absolutely.
folks going. That's awesome.
Absolutely.
That's great.
Yeah.
Good work.
Thank you. Thank you.
Go
Do
ahead,
you have any
Angelique.
details about the placement?
I'm sorry.
Do you have any details about the job placement?
It was actually here at ACT for a peer support specialist.
Oh, look at that.
Yeah, so
We
awesome.
absolutely need to be starting with our own network in terms of a commitment to really seeking to make our job opportunities available to good candidates from within the pool of folks living with
Hmm.
HIV. So that's
Right.
pretty fabulous role modeling. That's
Yeah.
awesome.
And
Yeah,
also,
yeah.
I want to start a job bank, so I would need your help to give me
Let, let's
job.
plan a
Yeah,
meet.
for sure.
Mhm. Jill, Sylvester, and Mark. So that role is in the same building we were earlier this year. So that's where that person um, will hopefully be if they get brought on. It's that same connections building for that role. Pretty cool.
That's
Angelique, floor
awesome.
is yours.
Tomorrow, my church is looking for a 20-hour person per week for um secretarial position to actually support the pastor. So if you have someone
For
that's
sure.
looking for something, just walk on over.
Okay, I don't, what's the address?
It's right next door to you. The
Oh,
church,
okay.
Right
yeah,
here. Oh,
yeah,
wow. Look
Oh,
at that.
gotcha, gotcha.
yeah.
Very cool.
Um, my Rios from the HRSA side, um, that we update him on the progress of the workforce initiative. So during my monthly calls, I get a chance to kind of update him as to how many referrals and where along the timeline folks are in terms of their job seeking um, abilities or whatever, for lack of a better term.
Journey and yeah.
Pathway, yeah.
Well, we can create a I'll get with Tamara. We can create like a living document and update it and make it accessible and all that good stuff. So we
That-
can do that.
I think that would
When's
be
your
a great
next
idea.
meeting, Angelique?
It's usually the first two.
Okay.
Can I say that I think that um, challenge that all of that record keeping will present create the opportunity for us to take a look and see if we can identify any barriers that,
Mhm.
especially any that may seem to be a pattern that maybe we can think through ways
Absolutely.
or prevent.
Yeah, we can absolutely do that because, with the record keeping, and it's good in theory, but we want to make sure that it flows and it's accessible to everybody, and anybody can just look at it and know what's going on. So absolutely, we can do that for sure. Um, oh, Jill, floor is yours.
Hi, good morning, everyone.
Hey.
I just kind of wanted to tag on to Tamara because she's doing a lot more than just interviewing people and asking them questions. Okay, so we're collaborating with a customer. He's an immigrant, but he does have his working papers, and he was a business owner. He owned a restaurant, entrepreneur. He also was a general manager for a construction company. He's very well educated, smart guy. Um, English is a second language. His primary language is French, but he's learning
Oh,
English
wow.
and he could carry on a conversation. He's doing well.
Mhm.
So he's in a bit of a situation, needs a job like now for child support purposes and court purposes. Um, but I don't want to just throw him in a job when he has so much to offer. And
Right.
so what we're doing is trying to get him like even like a pizza delivery, a delivery driver, something that will give him some flexibility in his schedule. He could choose his schedule. And I hope he registered, but Capital Workforce Partners is offering their jobs funnel training in um December. And so he can get stackable credentials. It's a 1 week crash course and he'll get his OSHA 10, his flagger, which is $50 an hour, by the way. He has a
Wow.
car, reliable transportation. So that's the only eligibility that you can work in the United States. You have a car and yeah, that's it. And you're interested in construction to be a flagger. Um,
Did you say $50 an
50,
hour?
50 an hour. Now, some I've seen advertised for like 22, 25, but the lady that's been on my street all summer is making $50 an hour. It's a union job. Um, so anyway, they get
Wow.
that, they get the scaffolding, and then there's like a safety. So it's four stackable credentials. So hopefully he'll register for that. Again, it's a 1 week boot camp. He'll get those credentials so that we can work on long-term planning for him to have more sustainable wages. So I want you to know that Tamara's doing a lot more work than just trying to put person in a job and focus on careers as well. Okay?
Thank you for saying that, Joe.
You're very
I
welcome. You're
appreciate that.
doing great.
Thank you.
So awesome.
Okay.
I can I just
Yeah.
I'm intrigued by I feel like this is a really great case, sort of a case study for us. And Jill, am I correct that this is the gentleman that has demonstrated extraordinary motivation and commitment and follow through? So demonstrating some of the most powerfully desired qualities for most employers. And the barrier being that he has incredible experience and expertise from another country and culture and in a different language. And so he's having the challenges that immigrants often have in this country, despite being an extraordinary person. Um, and so what I'm hearing is that a fairly quick, super short training may set him up to be competitive for a job that would really pay a decent hourly wage, as at least a bridge job until he got into the actual career he most wants to be in. So it would be an extra, first of all, if we could aim everybody at jobs that paid $50 an hour, that would be
Yeah.
a great objective.
Or what?
That absolutely is not the poverty level wages that a lot
Mhm.
of folks without services and support may be vulnerable to needing to take, finding themselves taking. So I'm really excited to keep at least that one individual's progression as a focus for this group because I think it helps make concrete what the meaning of us all. I mean, it's an extraordinary thing that this many people have been so committed to meeting every 2 weeks and all of the work that Tamara is doing and Brendan is doing and Jill is doing and everyone has been doing. It's really helpful to us for this initiative to really um, have the chance to understand in a much less abstract way what the meaning of this is in the life of an individual and their family. I'll stop there. But I'm just very appreciative. Kudos.
Good job, everybody. Angelique, floor is yours.
So I just want to also remind us all that Tamara is doing this as a split position. And as the referrals come mounting in, I'm not sure how realistic this is going to be to maintain and to have her do this. So I think we want to think about 2025 and what that will mean for this role in terms of funding. And in terms of sustainability, and not to have Tamara burned out, because the other part of her role is also a really intensive component as well. So I know Cheryl is on the call, and I'm just kind of wondering where do we where the discussion should go for 2025 in terms of the navigator's role.
Cheryl, you're muted if you're talking.
I know I'm muted. I'm trying to find where the little thing is. Yeah.
All good.
So, Angelique, that's a good point. We were just at the H.O.P.W.A Institute, and which was a very kind of stimulating conversation. And we were at the time kind of trying to think about different ways, because the city has funds that we have not spent year over year that have accumulated. And we have been in discussions as to how to actually use some of those funds. So I think that, there are a couple of things on the table, but Angelique, I like that idea. So, this is not for here and now, but it is to kind of bring back to the leadership discussion where a lot of other, additional voices can be heard on some of this planning that we have for effectively using funds. But I like your idea, Angelique. So.
Okay, perfect. Thank you all. Actually, before we move on, Danielle, let me circle back to you. Earlier, we were just giving updates on the groups, the PEC groups, connections group. Is there a time that we can sit in on one of your groups winning? But I remember you were saying one of the meetings, I think it's all women, and maybe you might be the best person. That's completely fine. We're just trying to scale if there's a date. Is it this month, next month? Because when Pastor Andre went to Connections, we got a clean bill, no notes on the flyer. So we obviously want to get different points of views from different groups. So yeah, that's where we are right now.
As far as the groups, the holidays, they
Yeah.
always have special things planned. So it will definitely be in January.
Okay. Yeah, no problem.
Yeah, and I'll give a definite date for January.
Okay, not a problem at all. Yeah, holiday time, pretty much after next week, it's, to the rest of the year, but that
Yeah.
works out perfectly. So we'll hold off on that.
Yeah,
And
because
I know
even
we're
the PEC didn't meet
got it.
this month. But I did talk to Angelique about, the PEC not having to wait to meet, but I'll talk to a Reverend about that, because the
Cool.
next meeting is going to be World AIDS Day for the Planning Council, so we're not going to be
That's right.
like that
Second, right?
in December. And then do we meet in January? that's a meeting month. So, I mean, again, it might wait until January, no, we can go
No,
ahead
if
and
you
have
tell me, yeah, if you tell me when you want it to happen, we can make it happen.
okay, yeah, so, because in fact, there, our PEC member who brings multiple members, called me because they went to the meeting and didn't know.
Wow. It was, yeah, okay.
Yeah. So she kind of came at me about it, but that's okay. I'll take it because I feel bad for them anyway. But so I'll let them know that it'll be a meeting, and we'll discuss the flyer then. But I need to coordinate that with Andre.
Okay, that works. All right. Saying earlier, pretty light agenda today. Oh, I can go into the Mercy job fair that I went to last Thursday. It was actually a really good time, and our partners at Mercy always do their thing. It was more people than I thought it was, which is always a positive. So how I set it up, we have a few jobs here at ACT, but how I set it up, I did half the table, just our roles that we have at ACT. We have one, the peer food support specialist, the one was Tamara was talking about, that's one. We have a bilingual manager position available right now. And that's for connection. But then over here in the main office, we have a transitional case management position available, working with the prisons and the supervisor for, no, that's not true. Nope, it was just those things. So people picked them up, people were interested. But the second half of the table was really why I was really there for the H.O.P.W.A Workforce Project. It's easier that we're working with, so I didn't have to like do my 007 thing. And I got a lot of names. So that's a long way to say I have a lot of names, but I'm going to follow up with people. Um, what gives me the most hope about what happened on Thursday, it wasn't just pulling the information. People were like, oh, what's this? So I would give them my information. I have like a QR code where it just goes right to me, which is an amazing thing. And I'll set up some time. I'll talk to them. I've already sent the initial follow-up email. Some people already got back to me. I got to give a big shout out to Tamara for helping me record the video. We did the video for LinkedIn and all that stuff, so people kind of knew what they were expecting. Got about 10 people on that list, and obviously it won't be all 10 that follows up, but I think that's a good uh, gauge to start. And making it clear what this program is fine. I relied heavily on the talking points Jill and Mark have given me over this past year. You don't have to be ready right now. This is just the comment, and it worked. And I think people were interested in it. So that's my update for the workforce. Yes, thank you. Oh, Pastor McGuire's coming on right now. The workforce project, I feel good about it. I let people know this is a living thing. It's not, something that just happens next Monday. You can get down with us and I'll keep you updated. So, oh, no worries. I'll keep you updated with events and trainings and the whole lot. And what I did, I asked for their case manager if they had one. So we can loop them into the email communication too, because I don't know where everybody was from. And it's important that people know that even if you're not in our conglomerate and you have a case manager elsewhere, we'll still take you just as long as in Greater Hartford. But it doesn't need to be. The example I give is I used to work at the Y before ACT. That's where I was. So at the Y, they don't have official case managers, but they do have folks who help you and support you. And I'll take that person's email address too. A couple of weeks ago, I was down at the YMCA to explain to them what it is that we're doing. Who knows? Maybe we want to do something there at their venue one day. They can hold up to like 80 people. So just really spreading the wings with the community outreach, with different layers, than just the client outreach, the case management. Sometimes it needs to be structural outreach as well. So that's what we're doing, and that's my update for Thursday. It was actually a really good time. I enjoyed it. The food was good too. I don't know what bodega they went to, but it wasn't Subway. It was really good food. I was surprised. Nobody want to hear from Mercy saying I'm surprised, but yeah, I mean that with love. Um, okay, Pastor Andre, we'll get into you for a second, but Angelique, I'll let you go first, and then we'll keep it going.
So I'm sorry. So the December 2nd event too could be a possibility where you get to network too about the workforce initiative. But before I forget, I just wanted to make an announcement, because Jesse Grant, who started out with us on the project, passed away last week Thursday morning. So I just
Really? Oh man,
yeah, I wanted
man.
you guys to know that he's no longer
Jeez.
with us, and
It's
realize
sad.
the impact that he had in the community,
Absolutely.
and the goals that he had met them before he passed. He wanted to own a home.
Yeah.
He did that. It's less than 6 months, unfortunately, but he did enjoy the time that he had in the house. I usually have daily, if not twice per day, he would call me and just rave about how great the house was shaping up, what some of the things that he was doing at the house. But he
Oh,
got sick and ended up in the hospital for a little while, and then ended up coming home, and then um, getting sick again, and ended up at Hartford Hospital this time around, where he never made it back home.
Yeah,
okay.
So I know it's
also
sad.
the impact working made on his life, and it was really
Absolutely.
really important to him, from going from affordable subsidized housing to home ownership. And I'm just blessed to see that journey, not just for him but for other people living with HIV. Some of the women in our programs, one young woman now own multiple properties, and she was in unstable housing, probably about 20 years ago. So it's just so important, and it's because of work that you have access to it. And that's what was so important for Jesse. He even was working from the hospital bed, giving me
I
stuff to
believe it.
do, like, dude, lay
Believe it.
down and you know what I mean? But working was so important to him. And he spoke about, being a peer worker, working with people, and serving people like himself. So that all of that is just so important. So
Yeah.
yeah,
So
yeah, I'm going to
if
miss him.
when you get the information about the services, please let us know. I was talking. He lives down the street from me. Um. Okay. Wow. Well,
Oh,
definitely thoughts and
so
prayers to his
sad.
family. His contribution can't be articulated by humans. So sure.
So
Thanks for
sad.
letting us know. That's pretty tough. He was just at our event earlier this summer.
No, yeah. What a sweet man.
Oh yeah.
And made a really beautiful contribution to the event as part of the panel.
Sure did. Okay. Well, thanks for letting us know. Okay, Jill, I will give the floor to you.
Yeah, I'm very, very sad to hear this news. Yeah, please keep us posted on the information. Um, I'd like to maybe suggest that we do a Jesse Job Seeker Award, so we can
Done.
think about honoring him.
Yeah, we can do that for sure.
The not even job seeker, but whatever,
But
some
just
sort of
yeah,
a
yeah, yeah. We'll figure out something.
workforce
Yeah,
star, like a
I like
workforce
that.
star award or something in his name. Let's keep
Going
him in this
forward.
project, please, going forward. Okay.
Girl,
Yes.
now you done jerked the tears, Jill. A good idea.
Yeah, we can
Yeah.
do that. Yes, we will. I'll have some mocks by the next time we
Yeah, or we could
or
rename the group the Jesse Grant Workforce Initiative.
could do that.
Yeah,
Do
that's
both.
even,
Yeah.
yeah,
We do some on an annual basis for sure. Okay, I was actually doing that
yeah,
for some other projects, so I'll just loop that in to see what we can do and get tissues apparently.
yeah.
So we will make sure we do that. Great idea, Jill. Thank you so much for that.
Thank you.
Yes.
Um, okay, so Pastor, hey, Pastor Andre. So I was given an update on when he went to Connections. Talked
Mhm.
about the list you gave me. Much appreciated. We're going to reach out to those folks. If you have anything to add about how the meeting went, that's fine, and then we can get into it.
Amen. Yeah, the meeting actually went really well, and kind of as expected for me when I was there. Probably everybody in the place I knew. I think there was one person that I did not know that was there in the place, but that was a blessing. And one of the things I started out asking them, I said, "Well, look, you guys remember the last time you saw me here. Said, has anything changed in your life, since last you saw me? You know, no, no, not really. I'm doing it. I said, well, do you want anything to change in your life? I mean, I keep hearing everybody, and they were talking about where they were living. They were having problems with where they were living. And of course, the connector being one of the ladies, as a matter of fact, was saying she needed to go do something about education. So she was going around the corner to Chrysalis so she could start a GED program.
Hmm.
And I'm saying to myself, yeah, well, did you realize that you could get all of the help that you need when it comes to uh, getting started with employment, getting education stuff set up right here where you are? And no, I said, okay, well, the program that we set out, and I showed them the flyer, and I asked them if that was something that they understand what it was in the first place, just looking at the flyer.
Right, right, right.
Everybody did seem to understand what was there. And the only thing they did say, because I came in with mine was a colored copy, and I was able to get copies there, but they were all black and white. So they were like, "This doesn't appeal to us. Why you have it like this? Why can't we have the color one like yours?" I said, "I thought they would have, would be able to do the prints in color, So I only did one from home, in color, and got the others in black and white. But I was glad I at least had the color one there, because that piqued their interest more than the black and white one. That's for me that's part of the reason as well. That's something part of course they would. It's more catchy. It's more tuned to the eye. The
Hmm.
other thing that I realized in talking to them, because many of them had were receiving Social Security or some other kind of benefit, and that was another issue that they were having. They didn't know how it would affect their benefits. They wanted to work, but they need to make sure that their benefits are squared away. So I talked to them about possibly being involved in a focus group. And I think probably everybody that signed up would be interested in trying to be a part of a focus group to find out more about how working might affect their benefits or if they can work. Because I told them, I said, one thing you can pretty much count on is everybody is probably going to be affected a little differently because people are getting different amounts in. So that means they may be able to work more or less. It depends on the circumstances. So, and we could check into that. So, they were really enthusiastic. They were eager, to talk about stuff. Since I came from here, I was actually able to bring a couple. I have little bags that you can put like maybe 12 to 15 sodas in it, keep it cold. So I bought some of those and I bought some ink pens just to give out to people, to just keep their interest going. And they wasn't looking for anything else. They got in, they had a good time, they were able to talk. Because I mean, like I said, I knew everybody in there. Matter of fact, one of the first things that was said when I came in, "Oh, Andre, please, we don't need no introduction for him. Just let him. What you want?" I was like, "Yeah, okay," But it was a blessing for me, and I think it was a blessing for them as well. And we still haven't heard anything from the other agencies that we sent information to.
Yeah, I was mentioning that earlier. I'm going to reach out to their higher level to see if there's just a new contact person. Sometimes that happens and we just weren't updated. But it was odd because they were back, they were responding, and
Right.
then it just stopped. So we'll figure it out. Even if there's a new person to, um, who's our connect, we just got to know who that person is so we can keep it going.
Yeah, man.
I'm sorry, I came in a little bit late. Would that be HRA?
No, what's the other one? C.
Oh,
Oasis?
yeah.
Oh, Brandon, why don't you call me after? Let me try to see if I can hook you up with Maria.
Okay, that sounds good. Is that the place with Maria and Cairo? Is that this?
Yes.
Yeah, that's where we make connections with them. That's who we're waiting to hear back from. But yeah, we'll figure it out.
Okay, we might
Figure
have
it
to
out.
poke her a little.
Yeah, no, that's completely fine. We could do that. And the project, yes, we can. All right. Okay. Does anybody have any general updates? This was always going to be a short one. The agenda wasn't too long, but just with the updates and what's going on. Oh, Jill and then Abby.
Hi again. So I went over to Mercy thinking it was a H.O.P.W.A project. An employment special had reached out to me. A specialist had reached out to me. She attended one of the panels that we had, one of the two panels that we had. And so she reached out to me. And so I went and I had probably maybe 7 or 8 job seekers, all really interested. And I did an American Job Center overview. And so then we all had a discussion and they wanted training in getting a job. And so I have this training that I do. Why should I hire you?
Yep.
And so I was scheduled to go back last week, I believe it was. And I told her to reach out to Brendan. I said, um, send this information to Brendan so he can invite all the Hopper projects to come to this training. One shot deal. Well, the ball got dropped. And so when I confirmed if we were still doing the training, actually, it was supposed to be today, this afternoon.
Hmm.
Are we still doing the training this afternoon? She goes, oh, no, I didn't get it together. We're going to have to reschedule. So, um, I've looked at my calendar and I'm totally booked for the rest of this month and all of December. So I thought maybe possibly January, but I know our last meeting, Mark, we had talked about you guys coming, you and Sylvester coming to Connecticut and doing some training. So I wanted to know if we could have a conversation to see where we stand with those trainings that we had talked about in the last meeting and try to figure out how to get that particular training in the books as well.
Yeah, that works. We can what are we, 6 weeks left for the year. How does everybody feel about a post New Year's training, just kind of jumping out the gate and top of 2025, just to get the ball rolling?
Amen.
Now, can I check? Is this so? In the last meeting, we talked about 3 dates to look at, and I think
Yep.
Brendan and Angelique and Erica were going to convene
Hmm.
to see which of those would work for a virtual training for service providers to sort of be a stepping stone to some in-person meetings to happen in January, and the general idea that was floated was for Sylvester and I to come and to be in Hartford a couple of days for meetings, including a meeting with Tamara, including a meeting, including Tamara and Jill, and potentially 1, 2, 3, or even 4 sites that were being discussed as good ideas for redirecting our focus to going where people are rather than planning events, expecting them to come to us.
Right, right.
Um,
Yeah, I mean, we could like for example, I know for a fact that one of those events or meetings we can organize like a in the same CMTI model. It's still technically they're coming to us, but it's just a part of the normal ones that we do. So it's not a separate
and they
meeting, and
normally come there.
yeah,
So it is really meeting them where they are.
right, and it falls in line, like the topic will fall in line because we have to fall in line with certain things. But I do two a month, so we do all like the medical ones, the first one or the second one, but it works out. So we can do one of those. Like I know that for a fact because I can just organize it. So for example, the first one of the year is going to be January 9th, and that's with Angie from Mercy, the one we were just talking about actually, and that's on creating a service plan. So we can potentially do the second one of January be about what we're talking about because the H.O.P.W.A Workforce Project it embodies so many aspects. Ryan White, H.O.P.W.A prevention, that we can get them all there. and move like that. So that is my 2 cents. What do folks
Would
think
that be
about?
the next week or 2 weeks later?
It's I usually do one at the beginning, one at the end, but just for context, it probably makes sense to
Uh-huh.
have hard numbers. I'm thinking so the ninth is that maybe like the 23rd or the 22nd. That would be 2 weeks later.
Okay. And does it seem feasible, Danielle, for the group that you do with women? Am I correct that you have a group of women that you meet with,
Yep.
and you had suggested might be a good group to have a chance to have something like this happen too?
Yes, most definitely. Yep. Yep.
And Pastor Andre, I'm wondering if what your thoughts are about at least one meeting.
Yeah, I don't have, I think it's a good idea. I think it's something that's necessary, and I think it's something you had stated earlier about trying to incorporate BRS and even the group that we were just listening to from Jill. I think a conglomeration of those things would be beneficial. It might be, I don't know if it's too much information in one sitting, or if we can just schedule a short series, um, to make sure that each one of the areas is dealt with.
Yeah, series is fine.
So,
I prefer them. I did a three. This is unrelated, but I did a three-part series with Gilead Sciences on cultural sensitivity. We did 3 parts, and we allow folks to sign up for all 3 parts. Like, we'll just make sure we do that now because they have
Mhm.
the investment, the psychological investment. You got to know how that works. But
Right.
we
will
can
Gilead
absolutely
provide a meal?
probably. So with the pharma companies, what we do is. We always have, I don't say always, like 95% of the time, I have one of them title it, do their presentation. But on off sessions, like I have this Thursday, I have Love 146 coming up from Stanford to do a human trafficking one. Obviously, it has lower registration because that's a heavy topic. I get it. And for ones like that are not pharma companies, I just buy like cookies and stuff. But for something like this, I can absolutely involve them. But before I do that, I do have a clarifying question because I'm just going to reach out to the venue today. Would we
Mhm.
prefer Wednesday the 22nd or Thursday the 23rd?
Let's see here.
Make sure
Our
that
li
it's not on the chip.
I
Is
already
that just
looked.
a, yeah, you already looked.
Yep,
Okay.
yep, yep.
Okay.
um, Either are possible from my perspective anyway at this point. And what I'm based on what I'm hearing, which are some great ideas and opportunities, I'm thinking that we look at those 2 days as starting with us meeting at minimum, Sylvester and I and Tamara and hopefully Jill and Brendan and possibly Erica. And then have a lunch and a meeting for the second part of the day, possibly with your group, Brendan. And then the second day, if there's somehow, so I don't know how this logistically is feasible. But if the second day we could have the first half of the day a meeting with either Danielle's or Andre's group, and then the afternoon the other one, whichever. I don't know how feasible that is to plan and how much it diverges from the regular schedules of the meetings that you already do, and if
I
that's
mean, it could
realistic.
it could be done. I pretty much stick to so I ask folks who want to facilitate, say, do you want the morning or afternoon? And they'll tell me, obviously Love 40 140 come from Stanford. Theirs is not until noon because they have to drive. But traditionally I've done a 10 to 2 or a 1 to 3, but it can be anywhere in the middle. So hypothetically, if we chose the later one, which sounds like it would make more sense for what we're trying to do, we could meet in the morning time and do all these things. Even here in the office, it's just us. We have the space for that. And then, yes, absolutely, Ivy. And then we would just go to the other venue. And so, in regards to the case managers or whomever it is that's coming, they'll just see something from 1 to 3. So they don't get confused. Like if we were to put out 5 hours, they would get really confused. And I learned that the hard way with other projects that I've been on. When I say 9 to 2, but only 9 to 12 is these, like that's confusing. So In a word, yes, it is doable. It's not a lot of travel. Everything is right next door to each other here. And so here's what I'll do. I will reach out to the venue and get dates for that entire week. I usually do CMTIs on Tuesdays or Thursdays, but there's no rhyme or reason to that. But yeah, I don't actually know why I do that. Maybe because TGAs are on Wednesdays, but so what I will do is see the availability for that entire week. And just to lean on the side of caution, I will give the same number as we did with for the larger one next Wednesday. Doesn't mean we're going to have that many people, but just so we know. And then they will let me know, hey, there's a meeting this day, there's a meeting that day. We can't do it, we can do it. And then once that's taken care of, I will, do the Gilead thing and the fly, all of that stuff, because we want to make sure that we maximize the amount of people that are coming and they know why they're coming and what they're coming to. Because one thing, Angelique, I don't know if you feel like this too, one thing that was great about last Monday is there was a lot of people that we've never met before. Well, I've never met before, but I like that idea too. But they were really interested in what we were saying. There's been several people that say, "Hey, can I come?" Like, yeah, you can come. When I was at the job fair, there was a lot of people, even some of our community partners, that didn't even know they can come to our meetings. And I was like, obviously, that's a different conversation for your leadership, but the interest is there, and I think that's the good idea. So
What
yeah,
I'm
that's what I can do.
what I'm perceiving is that those 2 days of meetings may be the first of a series of meetings with different guest speaker focus
Hmm.
beyond those meetings where um, we're in town. Um, it may be so an idea to consider is that having it be a series following that as sort of a launch, that
Kickoff. Yeah, 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 yeah.
future meetings could have one, possibly if Jill has time to focus to be one. Tamara would be one. The BRS benefits counselor may be one. The idea could be a longer list than that.
Okay. Okay. Yes, Angelique, that's a really good idea because that week, the 21st, that's one of our standing meetings anyway. So we already know all of us are available that time. So maybe we can just replace that because it's already blocked off in our calendar. So maybe part one is Tuesday, the 21st of January, 2025, beginning at 9 a.m. We can do that beginning part with us, and then if it works for the afternoon, the other folks, because at least we are available. And since we're the coordination team, that makes sense versus some of the case managers. If John Smith can't go, but Jane Smith can go from the same agency, there's really no difference versus when it's us, we want to be there. So if that's fine with everybody, I can have that the first date that I check with the venue. Is that
Well,
cool?
well, our meetings, our standing meetings, groups,
Yep.
for Phenomenal Woman, it's Fridays at 2 o'clock.
Oh, okay.
So
Okay.
just to let, because I don't want to, there's a reason, it's been working out great for the women to get, because, we cover women of childbearing age, and
Yeah.
they have to act for the school bus and stuff like that. And for years, it has worked well at that time for them
Time.
to attend and be able to get the kids off to school, do whatever, and then, but the other thing, thinking of the women, as far as job access, is a lot of times a lot of jobs now are computer based, remote based.
Right.
to have some type of program. I mean, we could even like San Juan Center, their job employment program, they partner with companies and stuff like that for returning citizens and stuff like that to get them job placements at the manufacturing companies and stuff. So they actually have that direct access. And I'm wondering, I would love to see this go to that point too. And one of the areas we could possibly do that is with remote jobs. And a lot of times it's customer service.
Right.
And I was even thinking we have a little space here, like so if any of the women, don't really have consistent access to the internet, they could actually come in and use the little room that we have and actually do some type of remote job. So it's just something that really builds up access. And then once they get started, hopefully they will learn how to do it from home, but people who do remote work will do it while they're traveling, while they're out of that kind of stuff. I have a friend, she got sick. She's not returning to going back to the office. She said, she's only accepting remote jobs. So it is, but she's in North Carolina, my college mate. So it's just that some people, that's what they want. But with our people, they might not have the tools in place to be able to do it. And we could maybe help out with that, at least for the training portion of those customer service jobs. You have to go through the training like that. So you really need access to the internet. I think the jobs a lot of times sometimes will provide the
Laptop.
laptops.
Yeah. Most
Yeah.
do.
But it's just something to look into. I don't know if they all do, if that's something we could offer. You know what I mean? Like space for remote work. You know
Well,
what I mean? Like that's like thinking outside the
yeah, yeah,
box.
yeah.
I've
I,
never heard of
I
anybody actually doing that.
I think that's a good idea. I'll say two things. I got a hard stop at 10. I got to jump on another meeting. The thing number two is maybe we can see if we can have a conversation with the Hartford Public Library to see if we can schedule some time to, block it off if they want to be a part of it. I know the renovations are there. I have an event there tonight. It's perfect. I have an event there tonight. I'll get the contact person and maybe we can invite like, hey, come to one of our meetings. This is what we're trying to do. Get some dates. I really think that that's something we can look into. And it doesn't just have to be Hartford. Like it can be, we can reach out to surrounding towns that are on the bus line. I know for a fact that East Hartford is looking for more of a collaboration with these type of projects. I know for a fact that East Hartford, from East Hartford, we're having a summer works project in the social service department, but it's not just children. So that's rolling out. They're actually looking for somebody to take that role. So these are things that we need to really use the greater part in Greater Hartford. Yes, and that's where we are. So before we close, I want to give Mark the floor, and then we'll get into it.
Um, uh, this is all such great stuff, and I'm so super impressed with everything everybody's doing and trying to make happen. It sounds like possibly if it could work, that week in January to plan the 2 days to be that Thursday and Friday. Am I hearing right that that would might be an ideal scenario? So Brendan and Pastor Andre, if that could work on for wrapping around what time? 2 o'clock on Friday afternoon. Is that right, Danielle?
Yep. Yep.
Oh,
So that's the
okay.
23rd and 24th.
The other thing I wanted to check in about real quick is I know that there was some question about our hope to do a webinar for service providers in December prior to these meetings happening in January, and the question about how much distraction and conflicting events are happening in the month of the holidays. I would like to ask that we schedule it anyway, and had a really good conversation with Erica about this. And a reason is because the promotional communications about the webinar are also an opportunity to build focus and awareness of the specifics of Tamara's services, this initiative, this project, as well as what's being planned to happen in January. So if it's okay that if it ends up being not the largest group that shows up in December, if it does end up being that the distractions make a difference in turnout, I'm hoping folks can be comfortable with us just moving forward and understanding the benefit of the communications, even promoting it as being strategized to include heightening awareness and focus and linkage to the information about the project and Tamara services.
Yeah, I mean the webinar itself, we just put it on the website. Um, yeah, I'm not too worried about that. If you can come, you come. If you can't, you can't, and we'll just put it on our landing page for that.
And it'll be
That's a small
recorded.
thing. Yeah, I'm not even. We'll just do that. When I get up, I
Okay.
mean, I'll throw some dates off, and I'll cross-reference it with the City of Hartford dates and all that good stuff. But I'm not. That is low on the list of things that I'm worried about. The
Cool.
webinar piece kind of makes it more possible than anything else. So we're good. With that, I have to jump to another meeting. If anybody has anything else that you think about after we hang up, email me. I'll be doing this all week or really every day, but you know what I mean. And we'll get into it. And I will not wait till our next meeting to give these updates though. So as soon as I hear back from the venues, I'll just email the group just so we can get on the same page because technically the year is only like 6 weeks from now. So we want to make sure that everything's planned and marketed and all that good stuff. So yeah. Well, you all enjoy your day. And I will see you I'll see a few of you tomorrow, but I'll see you guys when I see you.
Thank
Yeah,
you,
man.
everyone.
You're welcome.
Blessings,
Take
everybody.
care.